Želeo bih da priznam da se ovo okupljanje održava na tradicionalnoj zemlji naroda Bunurum i da odam poštovanje starešinama iz prošlosti, sadašnjosti i budućnosti. Želili smo da odamo priznanje svim drugim prve nacije koji su danas sa nama. Ova zemlja nikad nije bila ustupljena.
I'd like to acknowledge that this gathering is being held on traditional lands of the Bunurong people and pay my respects to elders past, present and emerging. We would like to acknowledge any other First Nations people here with us today. This land was never ceded.
Ovo predavanje će biti na YouTube-u. Mi smo već izdali dve i imamo dve od Dragana film, imamo dve koje smo radili. Ali mi smo u posljednjih nekoliko meseci otvorili na YouTube-u našu stranicu. Normalna stvar sa konsultacijom i sa dogovorom sa državom, Ministarstvom zdravlja. Ne treba, kada hoćete kažem ono jako teško, ja priznajem to. U ime Oca i Sina i Svetoga Duha, Oče naš koji si na nebesi, da se sveti ime Tvoje, da priđe carstvo Tvoje, da bude volja Tvoja kako na nebu, tako i na zemlji. Hleb nas našutni, daj nam danas i oprosti nam dugove naše, kao što mi opraštamo dužnicima svojih i ne uvedi nas u iskušenje, ne izbavi nas od lukavog. Amin. Svetite. Ime imate ovde Dr. Fahran Ulham, is that correct?
Yeah.
And your GP?
Yes, I'm GP.
And on je doktor opšte medicine ili GP kako govorimo. You can start.
Okay. Thank you very much. First of all, thank you very much for inviting me. As you mentioned, my name is Dr. Fahan. I work for a GP and as a medical director in a clinic called DPV Health in Broadmeadows. So today I'm going to have a little chat about COVID vaccination, or what's the situation of COVID-19 vaccination and what's the incidence of COVID infection in the community at the moment.
Thank you very much. Ja sam doktor Fahran Ulham i ja dolazim iz Broadmeadowsa medicinskog centra. Danas ja ću pričati o COVID-19, kako se on širi i kako da se štitimo od njega.
Next slide, please. So, I've been asked to come and speak to different communities. I've been speaking to different communities. I've done talks to Indian community, for instance, to Nepalese community, and now it's the first time I'm here for the discuss with the Serbian community from the Department of Health, because COVID infection is not gone. People think that COVID infection is complete. It's almost 3 years since the COVID infection was first discovered, but still there are a lot of cases we're discovering every day. So in a little slide, we're just going to have a look at that. Do you want to go to the other slide, please? That is still we have got recently we've got 10,000 cases in the past week. Only last week, about 10,000 cases were discovered, and out of those 10,000 cases, about 407 cases they are required to go in the hospital to get treated. And out of those 407 cases, about 17 were in intensive care. Intensive care is very, very dangerous condition, so they need extensive support.
Thank you. Ja sam iz Indije i bio sam kod mnogih etničkih grupa i predavao sam, ali prvi put se nalazim kod srpske grupe. Pitao me u vezi srpske kulture i tradicije, pitao je li diferent Bosnija i Srbija. Ja sam mu objašnjavao da ima Srba i ovde i tamo, čak sam mu objašnjavao i šta se dešava na Kosovu. On je rekao, po novim statističkim podacima ima 10.000, da još nije, iako je 3 godine nastalo, da još nije završeno sa koronom 19. Ima 10.642 i to je se povećano 15%. Imamo 407 ljudi koji su kritični i imamo 17 ljudi koji su u intensive care. Do we have any death person from this?
I think overall, I think so far in Victoria we had 8,000 people died so far because of corona since it started. 8,000 cases.
From what day?
Since it started, total number of deaths in Victoria is about 8,000.
Thank you. Kako je pre 3 godine počela korona, imamo skoro 8.000, da budemo precizni, 7.779 ljudi koji su umrli. I ja sam vam pre toga pričao da to nije igranje ili da neko kaže da to nije tačno ako imamo bliže 8.000 umrlih ljudi.
And about 9 deaths per day in the past 4 weeks, 9 deaths per day.
U protekle 4 nedelje imamo 9 ljudi koji su umrli.
Na dan.
To još uvek postoji.
Na dan.
A?
Na dan.
Na dan, je. Na dan.
Okay, next slide, please.
Je.
Okay, so overall, as we can see this graph, that's starting from January 22 to April 23, just recent, the overall trend is going down to the COVID. So it's going down anyway, but we're still seeing cases. So it's not completely finished. It's not completely bottom line. So this is, although it's daily cases are increasing, but we're still having some cases still coming into notice.
Vidite na ovome graftu kako smo bili visoki, ali sve idemo manje i manje na kraju ovoga u aprilu, ali se približavamo zimi i najverovatnije da će se taj broj povećati.
So COVID is still present in the community, still not zero cases, still cases coming every day.
Korona više nije zero, nula, ona se povećava svaki dan u našoj opštoj zajednici Viktorije i Australije.
Okay, next slide please. Okay, so what shall we do in order to protect ourselves and our family with COVID? So there are some recommendations from the government how to protect ourselves and our loved ones from COVID. So first of all, the most important thing, we have found a vaccination for this virus. It's just like a bad flu virus, but it is more infectious than a flu virus and it can cause more deaths. So the only thing we have discovered that now we have got a very latest vaccine against the COVID vaccine, so we should get vaccinated as soon as possible.
Thank you. Mi gledamo da zaštitimo nas, našu familiju i celu zajednicu Viktorije i treba da upotrebljavamo. Prva stvar koja treba da uradimo, to je vakcinacija da bi se zaštitili od toga.
Okay, so the other important thing which is important is to try to wear a mask. I know now everybody is more relaxed, nobody is wearing mask anymore. When this COVID started, everybody used to wear masks, even when you're going out, you're going to see the doctors. When you're traveling in the trains or in the aeroplane, you have to wear a mask, but it's not mandatory now. But we still, as a doctor, we encourage people, especially if you are vulnerable, if you are over 65 years of age, whenever you go in a place where there are a lot of people around, especially if you're visiting hospital or you're seeing a doctor, always wear a mask.
Thank you. Najbolja zaštita je da nosimo maske. Mi smo se malo opustili ovih dana i ne nosimo maske. I vidimo ovde simptomke da niko ne nosi. Ja ne znam da li još ima masku. Niko nema drugi masku, čak i on ima i nada.
Okay. So other thing which is important, always try to stay in places which are well ventilated. So a lot of air coming, so open the window. I know it's difficult because of winter, but if the chances of getting COVID virus is less, if the room you're in, with a lot of people around, they will be well ventilated. So the air is coming in and out easily.
Thank you. Kad ste vi u kući, iako je hladno, napravite da ima neka promaja, ventilacija ili ono, to je najbolji način da se zaštitite od
Very, very important that if you've got any symptoms, any cough and cold symptoms, you should stay at home. Try not to go and meet with a lot of people, because even if it's not a COVID virus, it could be a simple flu virus. So you can transfer this virus to others and that person can transfer it to the others as well. So if you have got any symptoms of cough and cold, you should stay at home. Try to not meet with the people till you properly recover from this infection.
Thank you. Kada ste kod kuće, iako kašljete i imate upalu neku ili infekciju i ovo ono, ne mora značiti da imate COVID-19. Ali zato sam ja podelio svima i pitao da li treba još nekome testove, da se testirate da nemate COVID, ali takođe i da gledate da taj virus koji vi imate, ako nije COVID, da ne prenesete na druge ljude.
Okay, so has anybody aware of the rapid antigen test? So there's a kit here, yeah? So if you got any cough and cold, any flu-like symptoms, you should always get yourself tested. This is a rapid antigen test kit. It is available free of cost everywhere. You can go to your local council, they can provide you lots of boxes. It's free, you don't have to pay for it. So everybody should have this kit in their houses. Anybody who develop any symptoms of cough and cold, it's very easy to test as well. If somebody is not sure about it, I can let them know, teach them how to do it. So if you got any symptoms, please get yourself tested with a rapid antigen test.
Da imate ovaj rapid antigen test i da ga držite kod vas kući, ako niste sigurni, ako ne znate kako da ga upotrebite, možete da kontaktirate vašega doktora ili možete da kontaktirate i nas kao organizaciju, ali ako vam treba ovo, možete da odete u opštinu da dobijete zadržaj. Ali ne mora zato da se skirate, mi imamo dovoljno i možemo da vam dajemo.
And if you are positive of COVID, so if this antigen test says that you are positive, you can call your GP and the GP can give you some medicine to help you feel better soon. There is a special medication, just like we have got antibiotics for chest infection. This is for bacteria. But now we have got special medication called antiviral medication. So if you have got COVID positive, call your GP and he can provide you with the medication. You take it for 5 days and it makes you feel better soon and you recover quickly with that infection.
Ako vidite kad ste upotrebili ovaj test i kažete, on vam pokaže crveno, ali kaže da imate virus, nemoj da idete nigde, zovite vašeg doktora i recite, on će vam poslati medikacije po kuriru ili po nekom od vašeg rodbine, da dođete i za 5 dana ono će vam pomoći da se očisti. Kao što sam ja rekao prethodno, nekada bude više od 5 dana. Moja žena je za 3 dana uradila, meni je trebalo 2 nedelje da budem malo bolje.
Okay, next slide please. Okay, so now we have got a booster dose. When this COVID vaccine, I think the COVID vaccine started, we started doing it for almost 2 years. Initially we asked them to have 2 doses, then we said we should have 3 doses, then we have 4 doses. Now we are recommending some people require 5 doses of COVID. The latest vaccine is a special vaccine. It protects you from a new type of virus. It's called Omicron virus. It's a different type of virus. Same COVID virus, it's got a special Omicron. So the new viral vaccine is called bivalent Omicron. So you should get yourself vaccinated if you're 65 and over. Go and see your GP and have a chat with your GP regarding getting the booster, which is the 5th dose.
Kao što sam ja rekao pre, došla je neka nova vakcinacija koja će pomoći da ne idete ono 3., 4., 5., ona se zove booster ili veoma jaka da vam pomogne da budete zaštićeni od COVID-19.
Yeah, so if you have your vaccine, last vaccine is 6 months or over, you can have the booster vaccine. So if you had, for instance, you had your 4th vaccine 6 months ago, you're eligible to get the 5th vaccine now.
Ja sam to već rekao, ali ponovit ću još jedno. Veoma je važno za ljude preko 65 godina i ovo, ali mora da prođe 6 mjeseci. Ja ću dati moj primjer. Ja sam imao 12. decembra i treba da čekam, hvala Bogu, nije daleko od 12-13 dana i onda mogu da primim ovu i ja ću je primiti.
And because of the winter, we give flu vaccine to everybody during winter. Now they are recommending that you can have your flu vaccine and the booster vaccine at the same time and the same day. So whenever you're going to get a flu vaccine, ask your GP to give the booster as well.
Ako mi svi dobijamo ovu vakcinaciju ili onaj ko hoće dobija vakcinaciju za prehladu, ali kada idete već kod vašega doktora i da vam da tu vakcinaciju za prehladu, tražite ovaj booster, ovu jaču injekciju da vam da za COVID-19. Is that they together is
Yes.
Zajedno oni su puno jači. Ne ono primim jednu pa ću drugu.
Okay, next slide please. Yeah, so currently the recommendation is if you are 18 to 64, you are eligible to get a COVID vaccine booster. And it is highly recommended if you are 65 and over to please get it, because it's very, very important. If you are 65 and over, the chances that you will develop complication from COVID infection, possibly a pneumonia, and you might have to go to the hospital and in the intensive care, and the risk of death as well.
Ako ste vi između 18 i 64, oni preporučuju, ako ste preko 65, to smo mi ovdje 99% većina, veoma je riskantno ako mi ne dobijemo to. Možemo da dobijemo amoniju, bolest i da završimo u bolnici, od te amonije može da se umre.
Especially people who have got diabetes, who have got asthma, people who have smoked cigarettes, people who have cancer, if having any treatment for cancer, they are at increased risk of developing complication from COVID. They should get a booster dose.
Oni koji imaju, počet ću do dijabetisa, koji imaju problem sa disanjem, koji puše i koji imaju druge bolesti, njima se obavezno preporučuje da prime ovu boosta, jer oni su u toj najrizičnijoj eri ili kategoriji.
Okay, next slide please. Okay, so now this slide discusses there are two different types of tests we can offer. We discussed about the rapid antigen test. You can do it at home and you can get these kits free from lot of places. But there's a more confirmatory test called the PCR test. The PCR test you can go to either to your GP, or there's some respiratory clinics all over Victoria. There's some special clinics where there's a doctor, there's a nurse, they can arrange. The PCR test, they test it through your nose and your mouth, so it's more, and they send it to the lab. So PCR test takes about 24 hours or so to get it back. So if you need further testing, this is free of cost. Even if you don't have Medicare, you can still do it. You can still get these things done.
Šta je najbitnije u ovome? Da je sve besplatno. Doesn't matter da li imate Medicare ili bilo koje drugo osiguranje, samo se prijavite i nema nikakvih problema.
Okay, again, this shows how to wear a mask. So mask should be worn properly. So it should cover both the nose and the mouth like this. You can see this in this picture. This is the proper way to do it. This is a proper mask. It's available. So that's how you should be wearing. So should cover your nose properly and your mouth. You should not be wearing like this or this or this. So this is the proper way to wear masks.
Ove maske ste i dobili, ovu vrstu maskaka, koja se zove N95 su najbolje i najodgovornije. Imate u vašima tim cegerima ili to smo vam mi razdelili. Znači ove druge maske nisu toliko zaštićene, ali može da se uvode.
So especially, as I said, if you go and speak to if you have to go and see your GP, because in the GP clinic, a lot of people are coming with coughs and colds. I would suggest strongly that whenever you go and see a doctor or you're visiting a hospital, always wear a mask and do it properly.
On kaže kada idete kod vašeg doktora, opšte prakse, i kada idete u bolnicu, vi nosite. Od pre 2 nedelje je obavezno kada idete u bolnice ili kod nekog doktora da mora da nosite masku. Ako dođete sa ovakvom maskom kao što ima Tonka, oni će reći da bacite to i da će vam ovu što ima Vasil dole. Ono je propa maska.
Okay, next slide please.
Yeah.
Have you got any questions? Yeah. So basically, the way to this is a general rule to prevent any infectious disease. That in order to prevent a flu virus or a coronavirus or any other problem, how to prevent it? So basically, you need to use a good ventilation in the room. So let the fresh air come in, especially during the winter season. I know it's difficult, but if you can open the window nice and clean, that will help it. For instance, the cooling system has to be, and the heating system has to be designed in a way that it should have a free fresh air coming inside the room. And for instance, if you can use a air purifier, there are certain machines available, especially in GP clinics, they use this air purifiers. So or if you can use the ceiling fans, for instance, this fan is slightly better because it can rotate the air. And and try to limit the number of people in a closed space. That's how we should be preventing this infection.
Imamo ovdje, prva stvar je ventilacija. Pošto mi smo ovdje nismo imali ventilaciju, mi smo 2 puta otvarali vrata da bi ušao svež vazduh. To je bio prvi razlog. Drugi razlog je bio jer je bilo dosta vruće. To je jedan bio. Onda smo cooling sistem, to je ovo što imamo, on greje i on ladi. Onda smo kod nas u kancelariji imate jednu malu, možda će vam Kristina pokazati, ovako mala za onu kancelariju, ona je dovoljna da čisti vazduh. I zbog mojih radnika, i zbog vas koji dolazite ovde. Najbitnije je da vazduh cirkuliše, da niste zatvoreni kao što kaže da nema promaje ili da nema da vazduh cirkuliše, limit number. I veoma je važno koliko ljudi ima. To se računa po nekoj kvadraturi i sve drugo. I explained that we got in the office something very small, but obviously we don't need more than that.
Yeah, that's right. Yeah, so again, just to summarize, if you got positive COVID test, you should stay at home till you fully recover from that. Try to not go out and meet with other people, and try to call people that I've got COVID, please don't come and visit me till you recover.
Za nas je najbitnije da vi, ako dobijete COVID-19, da ostanete kod kuće i da ga ne proširite na druge ljude ili na drugi narod.
And there's a number if you're positive for COVID and if you cannot go out and need some help. For instance, if you need some sort of shopping and if you're in difficulty regarding finances, you can call this number and they can help out.
Ako vam treba pomoć, ovo je veoma važno. Nema sutra da kažete ja nisam znao, ja nisam imao. Možete da pozovete ovaj broj 1800-675-398. I druga stvar, možete da pozovete nas, ako ne možemo mi ćemo poslati dobrovoljca, volontera ili nekoga od radnika.
Ask them if they've got any questions, I can answer their questions.
Doktor je završio sa izlaganjem, možete slobodno da postavite pitanja ako imate. Ovaj broj što je Milan pročitao, zovite nas i hoću samo dodati za ovih 50 klinika što je doktor spomenuo u Viktoriji. To nisu samo klinike koje su dostupne pacijentima koji imaju COVID, nego i onima koji imaju bilo koji problem sa disanjem, primer flu, malo veću prehladu, oni rade uveče, oni rade noću i oni su dostupni vikendom. Zovite nas, mi ćemo pronaći najbitniju kliniku na osnovu toga gde vi živite i daćemo vam sve informacije.
Aleksandra, sine Ljema, ovo što nam je sad...
Malo glasnije, ne čuju.
Da, izvolite.
To nam je Milan sad rekao taj broj, mi imamo taj broj na vašem pismu.
Jeste, mi šaljemo svakog meseca pisma sa tim brojem, ali nebitno, ako se to pismo baci, izgubi, zovite kancelariju, mi ćemo vam uvek reći koji je taj broj. I naći kliniku koja je najbliža do vaše kuće.
I'm okay, thank you very much, thank you.
Jel ima neko pitanje, neko? Pitanja?
Any questions?
Svi smo zadovoljni.
They're very happy. They don't have any questions.
Just to summarize, so I'm just going to summarize that. So, as I said, the most important thing to prevent severe infection from COVID, even death, is to get vaccinated. And it's important to get some booster vaccine, which is a new vaccine, much more stronger vaccine to get it vaccinated. So please make sure that you speak to your local GP and he can give you the vaccine with the flu vaccine. So make sure that everybody have a chat with their own GP to get a booster vaccine, because still this vaccine can prevent your life from getting this severe infection. Very, very important.
Evo doktor samo još jednom hoće da ponovi da je jako najbitnije u celoj priči sa COVID-om da se vakcinišete. Postoji nova vakcina, booster vakcina. O tome je najbolje sa vašim doktorom opšte prakse da pričate u kombinaciji sa flu vakcinom, vakcinom za grip. Ona ima najbolji efekat, ali ipak o tome svako priča sa svojim doktorom. To je najbolji način da zaštitite sebe.
And if you develop COVID infection, if you tested yourself positive, call your GP. He will send you some special medication, antivirus for 5 days that will help you recover quickly from this infection.
Ako osjetite simptome COVID-a, uradite test i na testu dobijete 2 crvene linije, znači da ste pozitivni. Zovete vašeg doktora, danas postoje lekovi, kao što dobijate antibiotike, tako i lekovi za COVID, koji vam mogu ublažiti simptome i pomoći da COVID prođe brže.
Yeah, it's an antiviral, not antibiotic, it's an antiviral medication.
Just an example.
Yeah, this is that. Let's go.
Antiviral
Yeah.
lekovi se zovu. Svaki GP zna i preporučit će.
Okay, any
Kad ste imali zadnju?
Posljednju za COVID. Kad je bila posljednja, treća doza vakcina protiv COVID?
Kad smo mi ono počeli primat, znaš Mila?
Pa šta znam, ja ne znam šta sam jutro znao.
Pa ne, znao kad smo primali svi neke te vakcine.
Kada je to bilo? 21.
Je bilo prošle godine.
Ove je bila ona zadnja.
Imate zapisano datum na onaj.
if it's 6 months,
Je.
she had it. If it's more than 6 months, she can have an additional one.
Kaže,
Vi na onom papiru, oni su vama dali, ima datum, je upisan kad ste primili vakcinu. Ako je prošlo 6 meseci, možete da primite ovu novu, najnoviju.
Pa je, prošlo je sigurno.
Eto da znate, pričajte sa doktorom, znači vi možete primiti sada novu vakcinu.
to je bilo u oktobru 21. prva, posle onda druga i treća. Imam ja ovdje na mojoj karti.
Just bring them for inviting me today, and then if you have any question, I'm more than happy to come back.
Evo, on se puno zahvaljuje što smo mi njega danas pozvali.
Pozdravite ga jednim aplauzom, ajde.
Je.